Good evening, everybody, and thank you for joining us on this scorching hot evening. Even at this time of night, I barely stuck my fingers out the front door and came crawling back in quickly. So I feel badly for anyone who's sitting somewhere without air conditioning. My name is Wendy Edge, and I'm the coordinator for admissions for medicine for the Michael DeGroot School of Medicine at McMaster University. So this evening, I'm going to talk to you about a few things and to do with the admissions process, and then we're going to have one of our students from the class of 2023 give you the student perspective. So if I don't scare you away with all of these requirements and the way we select our students, Anna can give you what you really want to hear, which is what is it like to actually be a medical student at McMaster. So I'm going to talk about the requirements, the process for making your application, and the selection process, how we choose our students to be admitted, and then I'll turn it over to Anna. At the end, we will either sort of allow you to unmute and ask your questions out loud if you wish to the group, or you can put your questions in the chat, and we'll look after everything at the end that we haven't looked at throughout the presentation. So one of the main questions that we often get is what's different about the McMaster MD program. So I think the biggest difference is that it's a 3-year program. I think that's one of the reasons that many students select us, and it's also a reason that many students don't. So McMaster and the University of Calgary are the only two programs that graduate you in 3 years. So if we don't kill you, we do finish you off a year early. Our program starts, however, in, well, I've got mid-August. It's actually seems to be creeping backwards. It's early August. I should change that. So this year's class will be starting on August 9th, and next year will be August 8th, 2022. You have 2 weeks off in the summer, a week off in December, right around the Christmas break, 1 week off in March, which is actually new to our curriculum, called the spring break, and you graduate in May of the 3rd year. So it's a very fast program. You're not off between April and September as you would be in a 4-year program. So it's one of the things that I think students really need to think about in terms of where they will attend medical school. So if you're lucky enough to have offers of admission from more than one school, that may well be one of the things that comes into play for you. The other main difference is the style of learning. And again, this is something that those who have multiple offers will really be able to think deeply about which works best for them. McMaster is entirely problem-based learning, which means very self-directed. You're working more in small groups than large groups. There are some large group offerings, but your main thrust of your education is small groups. You're working with a tutor in groups of 8 or 9 people, and I'll let Anna talk about this a little further, but basically as a group, you are sort of determining the learning for your small group of students and ensuring that you're covering all of the bases of your learning. So it is, to me personally, I think one of the best ways to learn, but it's definitely not everyone's best way of learning. And so again, something that you would think about if you are fortunate enough to have more than one offer of admission. You will find probably almost every university now, certainly this one, that there are satellite campuses. So most schools now have more than one campus, and one of the reasons for that, of course, is to have medical school learners and trainees in areas, particularly if they're underserviced. The hope, of course, is that some of those trainees will fall in love with those areas and potentially stay there and become physicians for that area. It's also a resource issue, of course. So if you have all the learners in one area, so for us, of course, the Hamilton campus is situated with the main teaching hospital, which is also teaching physiotherapy, occupational therapy, nursing students. So there are far more learners. It's a bit of a give and take, because I think there may be certain opportunities at the larger centers that you may not get at the smaller centers. But at the smaller centers, you won't be one of several learners in a room. So I think there's a lot of give and take with that, a lot of different opinions on what's the most suitable for individual students. So the Hamilton campus, which is situated on McMaster University campus, admits 147 students currently. That hasn't changed in quite a few years, and I haven't heard any rumors that it will. And then our Waterloo Regional Campus, which is in Kitchener on some space that's shared with the School of Pharmacy for the University of Waterloo, very lovely facility. They admit 28 students, and again, as far as I know, that number will remain the same. And the Niagara campus, which is on Brock University campus in the Cairns Family Health and Bioscience Complex, also admits 28 students. The two regional campuses are both in quite new facilities, have lovely learning centers and anatomy labs and things that are unique to their campus. The way we determine where students will go is through a lottery if we cannot place everyone at their first choice. So what happens is right after your interview, if you're interviewed, you're asked to rank your preference or let us know if you really and truly have no preference. So you will choose Waterloo, Niagara, or Hamilton as your first choice, second choice, and third choice. If we can go through and give every single student who's getting an offer their first choice, that would be amazing. That usually does not happen. And when it doesn't happen, we use what we call a rank-weighted lottery to fill the spots of the campuses that were not filled. So let's say, for example, the Hamilton campus is oversubscribed, but one of the regional campuses is undersubscribed. We'll do a lottery based on your rank. So if you're in the top 1/5 of the rank order following your interview, you automatically get your first choice of campus. If you're in the second 5th, your name goes in the flower pot once, third goes twice, fourth goes 3 times, etc. There's no flower pot really, but that's just the easiest way to describe this. So we would draw your name to receive your second choice of campus. So the higher you rank, the better chance you have of receiving your first choice of campus. And your offer is binding to the assigned campus, so you cannot stay on the wait list and wait for another offer, nor can you switch with someone. So you will receive only one offer, and your choices are only to accept or decline. Well, the minimum requirements, I'm assuming most people on the call probably do already know this, but I'll go through these quickly in case not. We require 3 or more years of undergraduate degree level courses, complete by May of the year of entry, taken at a Canadian or US university. We do accept courses taken outside of Canada and US if that's all you have, if your entire education is international, and I'll talk about that in a moment. This is 30 half-year or semester courses or 15 full-year courses or any combination of that. Your cumulative grade point average on all courses taken, so just an overall simple average, must be a B or 75% in order to qualify. If you're watching med school application at all, you will know that that may be meeting the minimum requirement, but it's not competitive. So in the last 10 or more years, I would say the GPA of those who are gaining entry to the program is more in the neighborhood of 3.85 out of 4. So it's very, very, very high. So really, while you need only a B average in order to qualify, you really need an A or A+ average to be a real contender in the program. Not to say it's absolutely impossible, but given the number of applications we're getting, it's getting harder and harder for students with a lower GPA or a lower MCAT score to leapfrog against all of those who have extremely high scores. For the MCAT, you must write it within 5 years of the application deadline. So we will still be accepting in this application cycle any MCAT written in 2016 or later. You have to write the test by the application deadline, which is October 1st, and you have to release it by the OMSAS deadline, which is usually November 1st. Sometimes it's a little later. I may be quoting an earlier date than I need to be. But if you are writing it at the later end of things, make sure you check and see what that release date is. McMaster uses only the critical analysis and reasoning or CARS score in our selection formulae, and it must be at least 123. So you will know if you've ever written the MCAT that there are 4 other sections of the MCAT. We do get those scores, but we don't upload them. So we literally use only that score in our formula and we disregard the rest. For the GPA, as I just mentioned, we use an overall simple average of all courses taken at the undergrad level. If you go on a foreign exchange, we do not include those grades. We give you credit for the credit towards the number of credits that you need, but we disregard them when it comes to calculating the GPA. There are no prerequisite courses. You can do your undergraduate education in any field of study you wish, as long as it's at an accredited university. You cannot eliminate any grades from the calculation. So you will find that different schools calculate the GPA differently. So for example, the University of Ottawa uses a weighted GPA. So it's year 1 grades times 1, year 2 grades times 2, year 3 grades times 3. University of Toronto uses a formula where you have to meet, they use the grades from the prerequisite plus your next best, I'm not sure how many, in order to calculate the GPA. They allow you to eliminate 1 grade from any years that you have a full course load. There's a few little things like that go on at other schools. So I think for the students that don't have the perfect educational background, that don't have excellent grades all the way across, you may find you fare better in an admissions process that does a little bit of recalculation. But McMaster is not that. That is not done that way. It's an overall simple average. So unfortunately, it means that it's very difficult to recover from a poor first year. So if in your first year, which is just a common thing we hear, the grades are quite low, it can take an awful lot of courses with really high grades to offset that. If you retake a course, another common question, and both attempts appear on your transcript, which they usually do, they're both included. And we include summer education, distance education, and any other courses as long as they're in Canada or the US in the GPA calculation. The other requirement that seems to cause a lot of questions are references. So we do require 3 online references. I think a lot of people get really caught up in who their referee is, and I would sort of caution you not to do that. The better reference is one that is coming from someone who knows you fairly well and will speak highly of you. We don't get caught up in that person's status or who they are or where they work, so you should not either. At least one should be non-academic, so speaking about you, the volunteer or the colleague or the church member or anything like that, as opposed to you, the student. You may not have family or close friends. Avoid asking another applicant to be your referee. We've certainly come across that a number of times where applicants have asked each other to write reference letters. That is a very bad idea. They are completely dismissed should that happen. We are not evaluating your referee, so select people that you know you well and will speak highly of you. The referees are asked now that the reference letters used to be just freehand, and we would get 7 or 8 pages of wonderful words about every applicant, but we need to read these, and so it wasn't particularly helpful. So they've now created across Ontario an online reference, which requires the referee to rank you and give just a small comment in each of those categories that are on the screen. So communication skills, problem-solving skills, professionalism, which is a really big deal in medicine. The students who run into professionalism issues are the more difficult students to remediate. So you will find that all medical schools are trying very hard in their admissions process to figure out if they are admitting students who will not run into those problems. Empathy and areas needing improvement, always a tough one for the referees. They want to give you a really great reference, but they're required to tell us something about you, and we all have something that could use some improvement. And then there's just one final box where they can write anything they wish. Another requirement for McMaster, and I believe there are 2 other Ontario universities and other non-Ontario universities who are using Casper. Casper was developed at McMaster probably about 8 years ago now. It's somewhat of a situational judgment test. You do it at your own computer at a designated time that you sign up for in the fall. I believe the Casper dates are out now, so they start for our applicants in October and go till mid-November. It requires you to log in at your designated time and watch video vignettes and then answer questions based on what you see. So the video vignette will be 1 to 2 minutes in duration. It will be an interaction between 2 or more people. Something is not going quite right in that interaction. The camera will stop and then the questions will appear. So basically it's what would you do in this situation? So if you were this person or that person in the video, how would you have handled this differently, or what do you think they did well or poorly in your interaction? You can go on to the Casper website at takecasper.com, and you will see some sample videos there to give you a sense of sort of what they look like and what sorts of things you're being asked to answer. The responses are timed. You get 5 minutes in total to answer 3 short questions that are posed to you. The main reason for the short duration is to avoid getting help, to avoid cheating, to avoid Googling, and all of those things. But the assessors are told that you are very time limited, so they're not getting caught up in spelling and grammar. As long as they can understand what it is you're trying to say, they're marking you on the content. So the application for all Ontario medical schools, as most of you probably know, that's 6 Ontario medical schools, are done through the Ontario Medical School Application Service online. The application this year will open on July 8th, which is next week, I believe, and that's for entry the following August. The final deadline is October 1st at 4:30 Eastern Daylight Time. October 2nd is my least favorite date of the year because without fail, there will be several students who were just about to submit and something went wrong, or they got distracted, or they didn't know what time it was, or any number of things. It's an online application. It literally closes at 4:30. If you are applying to Ontario schools, it's very unlikely that you can do something to your application in the last 20 minutes or half hour or even day that's going to change the outcome. So do yourself a huge favor if you're applying and submit early, either early that morning or either the day before, so that you avoid running into a problem at the very last minute and having your summer's work go to waste. There are no exceptions to the deadline. So be kind to yourself and submit a little bit early. So assuming you have met the minimum requirements, which is the 30 semester or 15 full year courses or a combination by May of the year of entry, that your GPA is at least a 3.0, that your MCAT CAR score is at least 123, and you've written Casper, then you will be ranked using our formula. So our formula for invitation to interview is 32% GPA, 32% MCAT CARS, 32% Casper score, and if you have a graduate degree, you receive 1% for master's and 4% for PhD. You must have a completed master's degree at the time of your application. So when you apply on October 1st, your degree must be complete. If you're simply waiting for your convocation, which is often the case, many universities have their graduate convocations in November, then you can provide us with a letter from your registrar or your grad supervisor indicating that you've been cleared to graduate by October 1st, in which case we would apply the extra bonus. If you're not finished your graduate degree, you're still working on it throughout the following year, you're not given that, that bonus. This year we had 5,868 applications. It seems to be going up every single year. And we interviewed 600 applicants this year. We do give preference to students who qualify as an Ontario resident. To qualify as an Ontario resident, you must have lived in the province of Ontario, which includes going to university in Ontario, for at least 3 years, and you must be a Canadian citizen or permanent resident of Canada. If you don't fall into that category, you're vying for 10% of the interview spots along with all the rest of the students who don't qualify as Ontario residents. It sounds like a huge advantage. It is an advantage, but it's not as big as it sounds. It would be if our applicant pool was 50-50, but it's not. It's about 80-20. So that advantage isn't quite as startling and large as it seems. So any students who attended an Ontario university for their first 2 years and plan to attend their third, or they already have, would be considered an Ontario resident in our formula or in our process. So assuming you've made it to interview, we use what's called the multiple mini interview. Again, this was developed at McMaster quite some time ago now, and you will find that you come across this at many medical schools now in Canada, in the US, and internationally. So it's a style of interview that has you meeting with 8 individual interviewers who are not interacting with any other interviewers. So it does get rid of the sort of halo effect where you made a quick decision, you may score an applicant low, but the next person along knows nothing about that. So they have somewhat of a fresh start and they're interviewing you and scoring you on their interaction without being swayed by anything else. It also allows us to predetermine the questions in the domains that we've chosen that we feel are important to us. Again, this is important so that an interview doesn't sort of go rogue and get into things that we don't actually want our interviewers to be asking our applicants. So we predetermine their question, their main stem, we call it, question, and any follow-up questions. The questions are sort of categorized in critical thinking, ethical decision-making. So again, here's this professionalism coming out again. Communication skills, knowledge of the healthcare system, which is not knowledge of medicine, but certainly if you're applying to become a physician, we hope that you've done a little bit of homework and a little bit of thinking about what the issues are in the healthcare system and how you will fit into the healthcare system. Collaboration skills, which involves you and another applicant interacting with each other. If we're doing something non-virtual, sometimes that interaction can actually be putting something together. But as I will say in a few moments, we are likely doing a virtual interview, in which case it's more speaking with each other. So in those stations, the assessor is just observing your interaction with another applicant. And the final category is personal interview skills. So this is more the question that you anticipate getting on an interview, where it's asking you mainly about your motivation becoming a physician, why McMaster in particular, and that sort of thing. So as I mentioned, in last year, for anyone who was involved in medical school interviewing last year, due to the pandemic, all of our interviews were done virtually. We were not permitted to do in-person interviews. Very likely we won't be again, and even if we are doing anything in person, it will not be in very large groups like that. So we are expecting that our MMI will be delivered virtually this year as well, and time will tell whether this will be the standard going forward, but certainly for this coming year. I'll give you a moment to read this. This is a sample MMI station that would be categorized as ethical decision-making, although I actually don't think there's any ethics in this station. So you would have a certain period of time, usually it's 2 minutes, to read this before you enter the room, or in our case, the virtual room, to discuss this with the interviewer. So I'll just give you a minute to read that. This question always makes me smile because I think I could have written it, although I didn't. So that would be sort of the dilemma type station, where there is two sides to the story, and you're having to weigh the various stakeholders and their views, and ultimately would make a decision around what you think is the right way to manage this. And this is a station that we would classify as a personal interview station. So it's more the type of station where you get to talk about yourself, your accomplishments, your goals, your dreams, who you are, and basically sort of give a sense to the assessor of who you are. So I'll give you a moment to read that. Apparently, when this station was used, some of the applicants came up with some extremely creative and interesting choices. So we're on to the selection process. So assuming that you have gone to interview, now we have a second formula where we are determining our rank order for advancement to collation. And collation is just a fancy name for file review. So basically, you're given a rank, your file is now reviewed by a committee, the admissions team, and then you would carry on to interview, or sorry, to offer or to waitlist or to refusal based on that file review. So that formula is based 70% on your multiple meeting interview scores, and the GPA and MCAT cars go back into the formula, but only at 15% in the second formula. That provides us with our rank order of to fill our 203 positions, and emails go out on the second Tuesday in May to all applicants who come to interview, and they're notified of whether they are receiving an offer, whether they've been waitlisted, or whether they have been refused. And this is the bigger picture of practicing as an MD in Canada. So you're applying to medical school with your 3 or more years of undergraduate education. That's the minimum. You're completing medical school in 3 or 4 years, depending on where you attend medical school. So again, McMaster or University of Calgary are 3 years. All other Canadian medical schools are 4 years, but you're off between April and September. It's something to keep in mind. You're going to apply to your residency training program in the final year of your medical school. So this is where you're deciding what type of physician or researcher you wish to be, and you're making an application to those programs to do your residency training. And they range between 2 and 6 years, depending on your specialty of choice. For the longer duration, which are mostly the surgical specialties, there is even training beyond that. So you do some subspecialization called fellowship. Once you are a resident, however, you are a paid member of the healthcare team. So you are still learning, you're still gaining your license to practice medicine on your own, but you are earning a salary and you are part of the team, treated a bit more as an employee slash trainee. You have 2 sets of licensing exams to complete, parts 1 and 2 of the Medical Council of Canada exams. Part 1 is an online multiple choice, half the day is multiple choice, half the day is short answer. Part 2 is what we call an OSCE. So it is very similar to what I described with the NMI, where there are multiple stations with an assessor in each station. So you're going sort of from room to room, or maybe a virtual room to room, and being assessed on your clinical skills by one assessor. You complete your residency training program, again, between 2 and 6 years, depending on your specialty of choice. And most specialties have college exams at the end of their residency training. And that is where, at what point you are then able to practice medicine on your own and bill to OHIP and that sort of thing. So I'm going to conclude there with my presentation. And again, we will have some questions at the end, but I have also, in case you don't wish to ask your questions in front of the group or in the chat, there is the email address on the screen, mdadmit@mcmaster.ca, and you can certainly send your specific questions there. So I will stop sharing my screen now and introduce Anna from the class of 2023. And Anna will take it from here and talk to you about being a medical student at Mac. So welcome, Anna.
Can you guys see my screen? All right, I'll just start now. So welcome everyone, and thanks for attending the presentation this evening. As Wendy said, I'm Anna, and I'm a student at McMaster in the class of 2023. And I'll just be giving you guys a quick rundown of what it's like to be a student at McMaster. And I'd be happy to answer any questions at the end. So just starting off, as some of you might know, McMaster is distinct from other medical schools in Canada in that the program is only 3 years. So this does allow us to get a 1-year head start into residency and our medical careers compared to our peers at other schools who are starting medical school at the same time as us. The shorter length of the program also allows us to have the most affordable tuition in Ontario. And the 3-year length of the program can mean that the course load gets heavy at times, but the program does put a lot of emphasis on student wellness, and we do get breaks every once in a while. Another key aspect of the program at McMaster is the emphasis on problem-based learning. So most of the learning that we do in pre-clerkship, at least, is done through self-study. So you get to choose the way that you study, whether you want to watch recorded lectures, whether you want to read textbooks or read journal articles online. So it's done through self-study, and the self-study is guided by learning objectives that we set in tutorial. So tutorial is where we come to class and then we read a case, which is usually about a patient, and it's usually focused around a certain disease and body system. And then based on the case, in small groups, we set learning objectives, and then we take those objectives and we go home and self-study. And then when we show up in tutorial, the next tutorial, then we'll take those up. So those tutorial cases are written to demonstrate concepts in a clinical setting, and we are encouraged to not just memorize the diagnosis of a disease, but to also ask questions and explore related concepts, such as the relevant anatomy and physiology underlying the disease, and how to approach management of a disease. So here is a big picture of what the 3 years at McMaster Medical School would look like. So there are two main parts to the program. There's pre-clerkship and clerkship. So pre-clerkship is about 1 year and 3 months long. As you can see in the picture, it starts around August of your first year and then goes into around November of your second year. So this is pre-clerkship is basically where we learn the basic foundational concepts of medicine. We accumulate the knowledge of medical science that we need to be doctors. And we also learn basic skills that we need to succeed in a clinical setting, such as how to take a patient history or how to do a physical exam. So pre-clerkship is where the tutorials that I was just talking about would take place. We also have some other classes in pre-clerkship that I will be touching on shortly. And essentially, pre-clerkship is divided up into different units where we learn about different systems in the body. Then after pre-clerkship is clerkship, which is shown mainly by the purple boxes on the diagram. So this starts around November of your second year and then continues all the way until you graduate. And during clerkship, students are full-time in the hospital or in a clinic, and they learn from firsthand experience. They're supervised by doctors or residents, and you would rotate through various different specialties. I'll talk more about clerkship later, but first we'll go into more details about clerkship. So this is just a breakdown of what the different units in pre-clerkship look like. So essentially, we rotate through different body systems and diseases related to them. And the terminology we use at MAC is called medical foundation. So each unit is called a medical foundation. So we start, or MF for short. So we start off with respirology and cardiology and MF1. Then in MF2, we learn about the renal system, hematology, and cancer. Then in MF3, we learn about the gastrointestinal system and concepts in nutrition, endocrinology, and reproduction. There's generally a 1-week vacation between MF3 and the start of MF4. And then you also get 2 weeks of Christmas break at the end of MF2. So Medical Foundation 4 is where we learn about the musculoskeletal system, the nervous system, and we learn some introductory psychiatry. After this is a 7-week block of electives, which is where we apply the knowledge we have learned to a clinical setting by spending full days in the hospital or clinic, learning directly from a doctor or a resident. So right now, my class is in this elective block. So I actually have an elective in pediatrics next week, and some of my other classmates have had electives or are going to have electives in things like cardiology and surgery, psychiatry, and various different things. And then so finally, after that 7-week block of electives, we move into Integration Foundation, which doesn't focus on any particular body system, but rather is where we review all the concepts that we've learned in the previous units and we apply them to more complex cases. So this is what a typical schedule would look like in pre-clerkship. Tutorial is twice a week for 3 hours each time. Clinical skills is once a week for about 3 hours. We also have a class called Professional Competencies where we learn about the humanity side of medicine. And on some weeks, we could have anatomy or extra clinical skills practice sessions. And the pink box here represents the active learning large group sessions that we have about once a week. And I'll be touching on each of these components. So as I mentioned earlier, tutorials are where we do the bulk of our learning in pre-clerkship. So we set learning goals for ourselves based on a patient case, and we take these objectives home and do our own self-study and research. Then we come back with what we learned to the next tutorial to take them up, and we have a group discussion about them. So again, tutorials are twice a week, 3 hours each day, and we are generally in groups of 6 to 8 classmates with one tutor who is usually an MD, sometimes a PhD. And again, as I mentioned earlier, the beauty of it is that students can prepare in whatever way they want and can explore more in depth any related topic that they choose. Some students choose to watch recorded lectures or read textbooks or journal articles, and other students find that they like other ways of learning. So they find like these online videos that help teach the concepts to them. Really, you can just learn in whatever way works best for you. So here is just a picture of what tutorial would look like in person. So students generally sit around a table to discuss the concepts that they learned while self-studying and also set objectives for the next tutorial. So all of the tutorial rooms are generally equipped with either a whiteboard or a smart board, which allows for more interactive and engaging conversations. Students often like walk up to the whiteboard and like draw diagrams and everything. But during the pandemic, I've had most of my tutorials over Zoom. And instead of like a physical whiteboard, we use online tools such as Jamboard or Google Slides. So we also do have lectures at McMaster in addition to tutorials, but these are technically active learning large group sessions, so they're not didactic lectures, and they typically occur only once each week compared to other medical schools, where other medical schools sometimes have lectures from 9 to 5 every day. So again, these active learning large group sessions are not didactic lectures, but they incorporate student interaction and various forms of active learning. Generally speaking, they do require some preparation work beforehand in order to get the most out of them. Before the pandemic, they would happen in person at a certain campus, and then the other campuses would teleconference in. But this year, all of our active learning large group sessions are over Zoom. So clinical skills is another class in pre-clerkship where we learn the practical components of being a doctor, such as how to take a patient history or how to the various techniques required to perform something like an abdominal physical exam. So clinical skills generally takes place at a local hospital, and it's taught by physicians. And we see standardized patients, which are actors who take the role of a patient, and we practice our skills on them. Pre-pandemic, there were also extra clinical skills practice sessions that would happen every 3 weeks. And for us right now, because of the capacity in the hospitals and everything, they happen about once every 3 months. Anatomy is an optional class at McMaster, but if you end up coming to Mac, I would highly suggest going to them because they are really useful and you learn all of the relevant body parts and systems that help you to do well in tutorial and learn the things you need to learn. It happens just about every 3 weeks. Sessions are a few hours long every time. And basically anatomy consists of looking at both plastic models and real human specimens that are prepared by the anatomist for us. And there are also generally didactic lectures that you could watch online every week as well if you wish. And finally, professional competencies is another class in pre-clerkship where we essentially learn about the non-science aspects of being a physician. So this happens every Tuesday morning and consists of a group of about 8 to 10 students with 2 healthcare professionals. And some topics that we learn include how to effectively communicate with patients. We also learn about things like population health, as well as the socioeconomic and cultural influences affecting health. So we also have sessions in professional competencies that teach us how to maintain self-awareness and work-life balance throughout our medical careers. So I'm just going back a few slides just to show you now that I've talked about all the different components of pre-clerkship, this is how it all fits into the schedule. So many people think McMaster doesn't have exams, which is somewhat true, but somewhat false. We do have evaluations. So at the end of every unit in pre-clerkship, our tutor, who basically supervises our tutorial, the tutor writes an evaluation based on your contributions to tutorial, how you did on various written assessments. And that's basically a narrative comment that will show up on your transcript when you apply to residency. For each unit, we have things called concept application exercises, which is abbreviated by the acronym CAE. Those happen about every 2 to 3 weeks, and it's basically a short answer test that's 1 hour long. And it's basically to test that we can apply the concepts that we learned in tutorial. So it'll usually those tests will give us a question about a patient presenting with this and this symptom, and then you have to explain the symptoms, explain how you would manage it. But again, these assessments are generally pretty low stakes. The mark on the CAE doesn't show up on your transcript. It just goes to your tutor, so only your tutor sees it, and then they sort of see. They use it to provide feedback and like see where you are at. There's also like multiple choice tests that we have every once in a while. It's called the PPI, and that's just to like test our progress throughout medicine throughout the 3 years in the program. And basically it's just to prepare us for the licensing exams at the end of the program, at the end of the 3 years. But again, they're pretty low stakes and they don't show up on your transcript either. And then in clerkship, you might have a variety of different assessments. So another important part of pre-clerkship is horizontal electives. So these are basically where students can get a taste of what it's like to be in a real clinical setting before they start clerkship. And these are basically observerships. So you go into like a hospital for like half a day and you're supervised by a doctor. They basically take you around and show you what it's like to be in their specialty. So it's a really great way to explore different specialties and get an idea of what you want to do in medicine. And this is particularly important at McMaster because McMaster is a 3-year program. And so there is less time to decide what you want to do in the future. But these horizontal electives give us a good opportunity to explore different careers. I personally had 2 horizontal electives last month or the month before that. Mine were in oncology and radiology. So in the oncology one, I got to go to the cancer clinic with a doctor, see her take histories and do physical exams on patients, and then also discuss what the treatment plans would be for them. And for the radiology one, that one was pretty cool because it was interventional radiology. So I was basically like shadowing a doctor it was sort of like an operating room, but not really an operating room. And he was basically doing all these different like procedures on different patients, which was just guided by like this big screen of like X-ray or CT imaging. And yeah, it was a really cool experience for me to see what it's actually like in a clinical setting. So just going back to our timeline here, I've talked about all the components of pre-clerkship, which is the first year and 3 months of school. And now I'll talk briefly about clerkship. So clerkship runs for about 1.5 years, and this is where students are full-time in the clinic or hospital. So you don't have tutorial anymore, you don't have professional competencies. You're basically in the hospital like 9 to 5 every day. Well, it depends on like the rotation that you're in. The schedule might be different. And there are basically 10 mandatory rotations that each student has to go through. These include things like general surgery, family medicine, emergency medicine, OB-GYN, psychiatry, and others. And usually these rotations, you would be in them for like a few weeks at a time, and then you would switch to the next rotation. And throughout clerkship, there are also 17 weeks of electives where you get to choose which specialty you want to explore. So you can choose any specialty during your electives, any specialty that is available, whether that's like oncology or like orthopedic surgery or whatever you choose. And then finally, after clerkship, you would be nearing the end of the program. So there are a few months between clerkship and graduation, and those few months are for just review of everything we've learned and preparation to write the licensing exam. And for the class that is coming to MAC this year, their graduation would be in May 2024. So in terms of campus life and all the activities that go on, there's definitely many events that go on every week and extracurriculars that you can get involved with at MAC. One big thing at MAC is interest groups. So that'll be like a group of students that get together over a passion for a certain topic. For example, we have like pediatrics interest groups, radiology interest groups, social justice interest groups, and I'm sure there are also like sport interest groups, and there's just a lot of different things that people are interested in, and they gather together to organize events for the rest of the class. There are also various positions on program planning committees available to students. So the program itself really values student feedback, and so we'll have various committees such as the pre-clerkship committee or the clerkship committee or the admissions committee or the electives committee, where students can be involved in planning various aspects of the program. Then we also have several guest speakers delivering presentations to students each week. These are optional lectures that students can attend for their own interest. And yeah, in general, there's so many events going on. I personally find it hard to keep track of sometimes. Students will often organize various social get-togethers and events throughout the year, such as like movie nights or board game nights. We haven't been able to do like that much during COVID this year. Most of the events have been online, but every once in a while, some people in our class, like with pandemic restrictions and everything, we will go on hiking trips and socially distant gatherings and everything. There are also various opportunities at MAC to volunteer in the community. Students have volunteered in migrant worker clinics, homeless shelters, senior outreach, teddy bear clinics. There's a lot of different things that you can be involved in at MAC. And finally, I'll just go over some of the highlights of MAC. So one of the reasons I really like MAC is because I wanted problem-based learning. I'm the type of person who doesn't do that well with didactic lectures. I find it really hard to focus during class, and I find myself having to rewatch lectures all the time. So problem-based learning really worked for me because it helps me to learn. It allows me to learn in whatever way I feel most comfortable. With problem-based learning, since most of it is self-studying, there's also a really flexible schedule. As you saw it, when I showed the schedule earlier in pre-clerkship, we have typically 3 hours or so of class every day, and the rest of it is dedicated for self-study. So you can really just choose to work when you want to work. And another big benefit of MAC is the horizontal electives that I was talking about in pre-clerkship. So those early experiences in the hospital or the clinic, they really allow you to, explore different specialties and see, do career exploration and see what you'd be interested to do in the future. And finally, I think it's a big benefit that MAC is only 3 years because residency is long. A lot of residency programs are 5 years long. So it's nice to just cut that extra year off of medical school. And that's it for my presentation. So please let me or Wendy know if you have any questions for us.